Good morning. My name is Keisha Herzog, and I'm from the Empowerment Program. Ms. Patricia Chambers, she's the director of the Empowerment Program, and Dr. Marilyn Thornton is the executive director of Families Helping Families of Greater Baton Rouge. On behalf of Families Helping Families of Greater Baton Rouge, I would like to thank you for joining us this morning. Families Helping Families is a family-driven nonprofit resource center for individuals with disabilities and their families. Our mission is to provide the individualized services, information, and support needed to positively enhance the independence, productivity, and the integration of persons with disabilities into the community. Our programs include the Bureau of Family Health, Early Steps, the Empowerment Program, Inclusive Education, the Resource Center for Autism Spectrum Disorder, and through the Louisiana Developmental Disability Council, LECAN, an advocacy network. Across all of our service areas, we provide information and referrals, education and training, and family-to-family and peer-to-peer support. Our empowerment program provides families in Louisiana with mental health, behavioral health education, skills, and resources to increase and strengthen their ability to function successfully. We provide in-person workshops, webinars, parent-caregiver professional monthly support group conference calls. We also have travel stipends to offer financial support to families to attend workshops and conferences. The stipend covered transportation, hotels, and meals. Please continue to check your email and our Facebook, Instagram, and Twitter pages for upcoming events, workshops, and conference participation opportunities. Just a friendly reminder, our upcoming empowerment programs and Families Helping Families events are as follows. Sunshine Social, the theme is Prom Black and White, which is May 17th this month at 6 p.m. at Breck's Milton J. Womack Park Ballroom, which is on 6201 Florida Boulevard, Baton Rouge, Louisiana, 70806. Reducing Antisocial Behaviors, which is a free webinar, Thursday, May 30th at 11 a.m., presented by Katrina O'Bolden from Superior Counseling. Free call-in support network, Parent Caregivers Networking Meeting, Tuesday, May 21st at 5 p.m. This is an opportunity for parents across Louisiana to share resources in their area. Mental Health Resources, Wednesday, June 12th at 5:30 p.m., presented by Elizabeth Latino from Ascension Counseling Center. Understanding and Managing Medications, which is a free webinar, Thursday, June 13th at 12 p.m., presented by Dr. Rosalind Thyssen from Trey Havelhart Foundation. Please visit our website and our Facebook page to obtain the conference call information and all webinar and in-person training registration links. During today's training, we will discuss navigating school mental health resources presented by Anthony Germade from Karman Learning. Anthony Germade is the founder of Karman Learning, which delivers trainings and videos on mental health, substance abuse, and professional development topics. He has also been a nonprofit executive for over 20 years at the state, national, and international levels. Please be advised that this presentation will be muted to all participants who are joining us on this webinar. However, you can type your questions in the chat box, and at the end of the presentation, I will give all attendees control of the mic if you have additional questions. Again, we appreciate you for joining, and now I turn it over to Anthony.
Thank you, Keisha. Thanks for having me, and thank you to Families Helping Families of Greater Baton Rouge for asking me to deliver this webinar, Navigating School Mental Health Systems. And we're going to kind of give an overview of how mental health works in most school systems. And we'll also get into mental health issues with our youth, as it's a very important topic with May being Mental Health Awareness Month. And as we wind up the school year, we just want to make families and people aware of the different issues and challenges and opportunities there are. So as I like to do with all of our webinars, is give some data in the beginning to get people familiar with the latest research regarding our youth and teens today. Between roughly 12 and 22% of teens, young adults, maybe college students today have a diagnosable mental health disorder. It's quite a high number. Between the 10-year period, 2011, 2021, teens that are feeling hopeless or anxious rose dramatically. And then, of course, the last few years, COVID with the pandemic, that really amplified anxiety, depression, and different mental illnesses in our youth. And with schools being closed, they weren't really prepared for the remote learning. Some schools did a very good job, some did the best they could, but it was very difficult for our kids and teens to not have the structure of being in the school system. So educators and school staff are often the first people to notice behavioral health issues because kids spend so much time at school when school is in session. So if you look at this graphic here this is regarding high school students. If you see the trends starting with 2004 and going up to 2021 there, you can see the data, how there's been an increase in these feelings of sadness, hopelessness, or anxiety, depression with our youth. And just a couple to point out specifically overall, it's going from 33% of our teens in 2004 up to 56% in 2021. It's a little bit higher now, but this is the latest research on this area. And then in terms of, you've got females, males, African Americans, and then the breakdown there. But every population, these feelings of depression, anxiety have increased. Particularly, I like to point out the jump from 2015 to 2021 with the LGBTQ community. This population is particularly vulnerable to mental health issues because of various reasons, stigma or lack of support and community and things like that. So we just want to keep a mind on some of these stats, as it'll help us kind of gauge the mental health of our young people. Some of the common mental health disorders in our youth, you can see here, maybe about 3% suffer from some sort of eating disorder, abnormal eating habits that could lead to things like bulimia and things like that, which can be a very serious health issue. About 9% suffer from ADHD or ADD, inability to concentrate, and may be hyperactive in some situations. About 13% have mood disorders, depression, which may affect their sleeping or eating habits. And then about 32% from the ages 12 to 18 has expressed some sort of anxiety disorder, or whether they've been diagnosed or not. And that's another thing. We need the help of our schools to let families know if they witness some sort of behavioral health issue with a student that is not normal for them, in order to access, and we'll get into prevention and intervention in a little bit regarding mental illness. Some symptoms to be aware of in our youth. Maybe if they're feeling sad or withdrawn, especially for more than a 2-week period. Every young person and young adult has periods, obviously, of depression or anxiety for different reasons. But if it lasts more than 2 weeks, or if the teacher or the school counselor communicates with the parents that they're noticing a change with their student, you want to maybe look into getting professional help for that student, and we'll talk about that in a minute. Seriously trying to harm oneself or planning to do so in younger kids, maybe, I'm not going to do a specific age, but like maybe, you know, 4th or 5th grade up to teenage years. Sometimes if you notice marks on their arms, it's called cutting. And a lot of times if a young person is experiencing trauma, anxiety, depression, you may see marks where it's called cutting, but it doesn't mean they're necessarily trying to harm themselves or get attention, but it's a way of drawing attention. Physical pain draws attention away from their emotional pain. But a mental health professional would be the one to diagnose that sort of thing. Sudden or overwhelming, excuse me, fears for no reason, or fast-paced breathing or a racing heart. That could be, if there's nothing physically wrong with the student or the young person, that could be a sign of a panic attack, which is a very scary outcome from anxiety. Getting involved in fights or desires to hurt other people, or severe out of control behaviors. These are all signs you want to look for in the student if they're occurring. Eating too much or not enough, as we mentioned, could lead to eating disorders. Inability to focus on daily activities that are in their normal routine. Other symptoms, suddenly causing class disruptions, repeated use of drugs or alcohol, or any substance issues, particularly if that young person has not been involved with those issues in the past. You definitely want to seek help in that situation. Severe mood swings that can cause problems in relationships, whether it's with parents or their friends or anyone else close to them. And then just any general drastic changes in personality or behavior. In terms of navigating mental health mental health systems in schools, now they're all going to be different. Okay, a lot of this data on this webinar is really primarily based on what I've researched and found in public school systems, East Baton Rouge Parish, Orleans Parish. They are similar to systems in private schools or charter schools, but no two are exactly alike, depending on their financial resources, depending on their compliance and issues. But we're going to talk generally about public schools. Teens and young adults, maybe college students, you have to remember, spend the majority of their time in school, okay, during the school session. And that's why I mentioned earlier that school counselors or teachers or other staff generally can be the first ones to recognize if students are experiencing anxiety or unusual behaviors. Schools play a critical role in supporting the mental health of students. If you think of this like a three-legged stool, you know, with the student, the parents and family, and then the school system, all have to sort of communicate, work together to support the students. Schools should provide students and families with information and resources for prevention, early intervention, and then treatment for behavioral health issues. I'll get into in a moment more details and specifics about that. Some of the benefits that school-based mental health services can provide are that schools can offer comprehensive mental health programs that help build better social skills with young people, self-esteem, increase self-awareness, and develop leadership skills. There are many school systems that really don't have programs like this. That's more for higher education or when you get into the workplace. But I'd really like to see schools have more programs that focus on what they're called as soft skills, as opposed to topics like science and math. But you see, I've got highlighted increased self-awareness, and that's a very important skill to start teaching our young people at an early age. The more self-awareness they have, the better and stronger their emotional intelligence is, then the more aware they are of their mental health and those around them. Schools that collaborate with community partners, offer more resources. This decreases the rate of poor behaviors. It improves positive attitudes in students and actually increases graduation rates. Now, what do I mean by collaboration with community partners? That's when schools have the opportunity to collaborate or partner with an organization. Let's just say, as an example, service, excuse me, emotional learning animals. You know, people that have a mental health issue can have the right to have an animal, a dog usually, or it can be whatever, and give them some sort of comfort. Some schools, I know LSU and Tulane do it. They do goat yoga, where they bring baby goats and they have yoga lessons. These are just a couple of examples, but you always want to, if you have a child in school, find out what the school is doing to partner with other organizations that can offer something to decrease the anxiety for their students other than what's in their traditional curriculum at that school. Also, students with school mental health supports are more likely to learn better, have better grades, be more engaged in school activities, and develop appropriate problem-solving skills. As I mentioned earlier, the pandemic caused significant disruption in the lives of students, requiring them to adjust their interrupted routines. There's a sense of loss of community and then isolationism. It's very, very important for our young people to have those social interactions and to be involved in their school activities. Schools are, since the pandemic, increasing their counseling and mental health support staff to meet the demands of students. I know some of you who may have students or children in school, the first thing you're thinking is the schools are overwhelmed. They may only have one counselor in the school system. And they're always, there's a waiting list sometimes for students to see them. But that's why you always, as a parent, want to be in communications with any particular teacher or whoever the administrative staff is, in order to find out if there's something unusual going on with your child's behavior in school. Now, school counselors can help prevent negative events by supporting and partnering with at-risk families. So what does that mean? If an at-risk student who has maybe had issues with behavioral health, and generally behavioral health is the term we use for young people as opposed to mental health with older people, but generally partnering with them in constant communications, consistent communications involving the student and their behavioral health throughout the school year. And then also keeping in touch with them in the summer. I know that August is the month before school starts that most schools do their professional development trainings with teachers and other staff. That's a good time to reach out and say, hey, do y'all have any kind of mental health program or something going on for professional development training in August before the school year starts? Prevention decreases the number of necessary interventions. Now, what does that mean? If you're able to recognize a behavioral health change, some of the things we listed earlier, and take some action, or get your recommendation from the school counselor on if the child needs professional help from a provider, and a provider just means a community counselor or therapist, having that prevention, nip it in the bud, as we say, can prevent episodes, outbreaks of mental health issues, outbursts later on. And that, if that happens, then you have to do an intervention, obviously, to keep the child safe. And it's harder to get the child back to a consistent, healthy mental health status. So you always want to look out for preventive measures. Prevention increases also the student's potential to develop into healthy, productive young adults. And again, we go back to the phrase I mentioned earlier, self-awareness. So next, early identification and referral resource programs shows that schools are fighting the stigma associated with mental illness. What is stigma? We've all heard the word. It's probably one of the biggest challenges in the entire mental illness field, the stigma about it. Okay, and back when I was a student a long time ago, people didn't talk about if there was a mental health issue in the family. The stigma prevented that. Now it's much, much better, but still, families, parents, students, school systems should always talk about mental health issues in whatever form is appropriate for that school or that student. Teens, young adults are more likely to accept professional help referred by the school counselors, and I'll get more specific on that in a minute, than someone from the outside. Why? Because they're comfortable with the school system. There's usually a trust between the families, the students, and the school teachers, administrators. Parents and caregivers are also more comfortable and trusting in accessing supports and services referred to by the school. So students and families, if a child needs professional help with mental health or behavioral issues, everyone is usually more comfortable when it's someone referred to by the school system itself. Now, how can school leaders and educators help? Now, we know, if you happen to be a teacher, you would know better than I, that teachers and even school administrators, school leaders, it's very difficult these days. They're overwhelmed with all kinds of things to worry about. But the mental health of our children, I think, is one of the most important things in addition to their academics. But communicating with school counselors helps them to recognize challenges observed in the classroom, know that a student's mental health is directly related to the way they learn and develop, cognitively and emotionally. If a student is stressed out, anxious, or suffering from one of the behaviors we talked about earlier, and it could be from anything, not being friends with someone they were close to at some point, or an event, natural disasters. We have hurricanes, we have the pandemic, we have events that happen that can definitely trigger anxiety and negative emotions in our youth. Making students aware, school leaders and teachers aware that they are available to listen if the student is experiencing negative emotions and challenges. That's something that teachers and school counselors, administrators always need to do. And they need to do it more consistently, not just once per semester or a couple of times a year. It should be like on a weekly basis. If you're feeling different or unusual, or negative or depressed, come talk to us. Help the student by, again, building self-esteem, emotional strength, self-confidence, and what these skills do is eventually help build resilience, emotional resilience in the child. Okay, let's see. Next slide. Spotting some of the signs that school leaders and educators, what they can do is help. I mentioned a minute ago, training sessions, professional development for teachers on how to recognize signs of mental health concerns in students, as well as the appropriate responses, what that would be. And that's just dependent on each particular school. They all have their own systems and compliance rules for what to do if a student is having challenges. Creating safe spaces, it's something that you think, oh, that's an obvious thing. When I was young, if a student had a behavioral issue, they would make us go sit in the library for a while. But now most schools have counselors, like I said, on staff Every child deserves a nurturing school environment where they can feel safe to express their feelings. Schools should establish these quiet, safe spaces, whether it's the counselor's office or wherever, where students can feel safe, express their feelings, emotions without the fear of judgment. Or sometimes young people, obviously, they don't want to talk to their friends or sometimes not even their parents about what's going on with them, and they may be more likely to talk to a school counselor. Integrating mental health into the curriculum. And all of us, if you're on this webinar and you're a member involved with Families Helping Families of Greater Baton Rouge, or if you went to Behavioral Health Day last week, it means you're an advocate. Whether you have a family member or student with a mental health issue or not, we can all be advocates for better mental health education. And also I included here substance abuse, which is also a big problem with our youth today. You always want to advocate for mental health, substance abuse education into class structures as a much needed asset in school systems. And as a parent, you're a student, you have every right to communicate with that school and request what trainings, what education is being done to help my student learn about these important topics. It can educate students, promote understanding, empathy, reduce stigma, very important, as we talked about, and then foster a supportive environment for all students. In other words, the point is we want to make mental health topics, substance abuse topics, common as part of common conversation, common knowledge, just like students talk about English, math, science, whatever they did their daily in their daily curriculums. Coordinating after school activities where students can volunteer at mental health nonprofits in the community. This is something that I've done in the past when I worked on staff with mental health in different nonprofits. We would always, and this is maybe for a little older student, meaning high school level students, always, in some schools, high schools have very good volunteer programs, and it does them an enormous amount of good. As an example, last year I worked for a school in New Orleans that had students, population with exceptionalities, Down syndrome or autism, and we would coordinate with local high schools where the students would come and volunteer or vice versa with different areas or on different projects in the community. Other ways school leaders and educators can help is to encourage parents and others to practice social emotional competency through their words and actions. What does that mean? Basically, being positive and communicating with our young people that it's okay if you don't feel okay. There's nothing wrong with you. They're not alone. There's different phrases you can use that should be repeated constantly. Mental health or mental illness even, especially anxiety, depression. Now, bipolar, borderline personality disorder, schizophrenia, those are far more serious mental illnesses that normally don't develop until young adulthood, if they do at all. But 1 out of every 4 or 5 young adults and our youth experience anxiety, depression on a regular basis. It may be off and on, but you always want to help them, encourage them by developing their competency when it comes to social and emotional skills. This requires teachers, school leaders, families, as I mentioned earlier, that three-legged stool, to engage positively with students. Building a common language for discussing this topic appropriately with students is important. Having guest speakers come in, and companies do this a lot. They'll have a guest speaker that'll come in and share their personal challenges or lived experience with mental illness in order to make students feel they are not alone. I've given many talks to high school level, university level students in different classes. And the very first thing I do is I say, I have lived experience. I've been diagnosed with depression and severe anxiety. And I might be standing up there wearing a suit, but it surprises them. And I'll talk about issues I had with substance abuse as a young person a long time ago. And it automatically makes anyone who may have similar challenges feel that they're not alone, feel that they can communicate, that if they have these issues, they can lead normal, healthy lives. Now, again, these bullet points here, as we talk about navigating the school system, we have to keep in mind that schools vary in the way they implement school-based mental health services. As I mentioned, some schools may have higher budgets or more resources to help the children. But generally, most public schools have about the same. Schools can provide access to prevention programming, as we talked about, early identification for mental health challenges, and then treatment options. Partnering with, as I mentioned, community mental health organizations, or doesn't have to be a mental health, it can be some type of nonprofit that works with social services or agencies to develop an integrated, comprehensive program of support and services. Unfortunately, it took the pandemic for a lot of these things that you see listed here to start being implemented, but it is happening. Even here in Louisiana, we're getting a lot more funding for these types of programs, which is a good thing. Now, in terms of legal issues or laws and rights concerning behavioral health services for students in Louisiana, a public school governing authority, and this is a law, shall not prohibit a behavioral health provider, therapist, counselor, from providing behavioral health services to a student at school during school hours if the student's parent or legal guardian requests the services from a provider. That's very important. It's something a lot of people don't know about. And then, of course, if this is necessary or needed, they would do a criminal background check, obviously on the provider or the counselor, and then the parent or legal guardian of the student receiving services from the provider would be required to just sign a release form saying that it's okay to work with their child. Also within this legal part here concerning behavioral health services, if they do need counseling during school hours, it may be provided during an instructional time, such as English, reading, math. That just means the student would, if they're really in need of assistance while they're at school, they're allowed to legally miss a math class or an English class, make up for it later if they need counseling during the school hours. If the public school governing authority and the provider agree that that time is in the best interest of the student. Any kind of costs involved providing a student with counseling during school hours is the responsibility of the parent or the legal guardian, but that is normally covered under the family's appropriate whatever health insurance policy or Medicaid, whatever they may have. So that's something important to keep in mind if it gets to that point. Now, behavioral health evaluations, if there's any kind of counseling done for students, evaluations are always done, but must include, but not limited to, a diagnosis, if there is a mental illness diagnosis that comes out of it, the type of intervention, what was done, in terms of intervening, let's say if there was a mental health episode, specific episode, the length of the intervention, and then identification of the student's goals and identification of the impact of the student's behavior on the educational program. What that means is basically if the child has a mental health problem or a challenge, is it a temporary one? Are they just experiencing depression or anxiety because of loss of a friendship, lower grades than normal. Maybe they didn't make the sports team, and it may be a normal thing like that, or it could be a more serious issue. Only a mental health professional can diagnose a child or young adult in these situations. As a parent or as a family friend or something, it's really important that we should never try to diagnose a child when it comes to mental health. And then the following mental health services that schools can coordinate access to include assessment, CBI, which is a community-based intervention. And community-based just means, again, getting a outside counselor or therapist involved, or some other type of mental health professional. Medication management, if required, and that's a whole nother topic that it's very important. If you're a parent with a child or loved one with a mental health issue, let's say if it's ADHD, you really want to be in communication with the doctor. Usually a psychiatrist, who is also a medical doctor, can prescribe medications. Generally, counselors don't. So you really want to be in communication regarding medications, because they can really help a child, but sometimes they can hinder them. It just depends on the situation. It's more customized. Other services can include individual therapy, group therapy, and then you see I have highlighted here family therapy. If the situation arises where your student or child has a serious or borderline mental health issue, and the counselor or therapist wants the parents, or at least one parent, available, definitely. It's always better if two parents are available to be involved in the counseling for that student. And then functional family therapy. And then I don't have it listed on here, but let's say you're a parent, you have a child that's having some challenges, and it seems to be maybe ongoing, whether it's ADHD or depression, and it seems to be going on for a while, maybe a few months. It's stressful for the parent too, obviously. So if you have this type of scenario, you want to look in your community. If you're in the Baton Rouge area, New Orleans area, there are a lot of support groups. Perhaps Families Helping Families through Greater Baton Rouge has some, or can refer some. NAMI organizations, chapters, and other nonprofits in these fields, a lot of them host support groups for a number of different, if there's a death in the family, let's say the child loses a grandparent, or something happens where they have a transition in life that's negative. There is just a support group for many of these areas. And sometimes I encourage parents, look into that. You can Google and find them in your community. And they're very helpful to help talk it out, see what other parents are doing. See, you can find resources that you may not know about from things like that. So keep support groups in mind. Also, other mental health services that schools can coordinate access to: interpersonal development skills, case management, which is basically following, charting all the data and assessments of mental health for the child, crisis intervention, as we talked about. Always better, prevention's always better than intervention if possible. Mentoring services, multi-systemic therapy, tutoring services, and then psychiatric rehabilitation programs. These are just some of the services. A lot of them may not be necessary depending on what assessment the child has. So, and again, as we talk about public schools in general, but East Baton Rouge Parish in general, their school systems, Department of Mental Health Services, their mission is to facilitate individual school change through empowerment, collaboration, counseling, and service. And here's an actual quote. I'll read it. Our vision is to assist students and their families in building and maintaining healthy relationships with their schools and communities while recognizing and celebrating individual differences, accomplishments, and choices. Now, that sounds good, but are all the schools implementing this? And again, schools are overwhelmed, administration is, sometimes teachers are, but that does not mean that they're not responsible for doing what they can to assist students with mental health issues. Now in terms of the school counselors, they work in basically on 3 categories to provide students with learning and support. Obviously academics, and then when they get to the high school level, career counseling is very important. And then as we've talked about, the social and emotional development of the student. Social emotional instruction acts as a shield against mental health risks. And this goes back to what I mentioned about prevention, okay? And being self-aware of now you can't expect a 10, 12, or even a 16-year-old to be completely aware of the emotions. They haven't developed emotionally yet, or some young adults even also. So that's why it's important. Communications are important. Talking to the teacher, talking to the school counselor, talking to their parents. I don't feel right, something's going on, and then in order to get them help. Teenagers especially, and you know this, internalize emotions and problems. Schools can be a forum for that self-expression if they have, as I mentioned earlier, that safe space, whether it's a counselor's office or whatever it is. Sometimes episodic mental health issues pop up suddenly. Sometimes it's gradual and builds. And as I mentioned, if you notice a change in your child or student over it's lasting several weeks, then that's when you want to possibly seek professional help. School counselors should work to support mental wellness with a continuum of care and the need to emphasize compassion and empathy. We are way past, long gone are the days where, a teacher or a parent or anyone, a legal guardian of a child, we used to call it acting out. Oh, they're just having a bad day. Well, are you sure? There could be something going on where they need professional counseling. Teenagers in particular tend to internalize emotions, as we mentioned, and problems, and school systems should provide a forum for their self-expression. Counselors should be aware of the cultural differences among students and how they express emotions differently from each other. This is an area that is not talked about nearly enough. It's basically under the topic of DEI, diversity, equity, and inclusion. Louisiana is very, like some states, but especially New Orleans, Baton Rouge, very multicultural. And as the populations change and shift and diversity increases, we have to understand that children, families of different cultures tend to need to be treated sometimes differently from someone of a normal population here, let's say African American, Caucasian, but if now you have Asian, you have Latina, you have Hispanic, you have different people of different cultures, and they all tend to traditionally treat mental illness in different ways, okay? So not to get into, this session is not really about diversity, but it's just something to be aware of that school counselors need to be, and that's something that schools can help the counselors and teachers with in terms of professional development. Do they need to communicate with a student who's of a different culture or different background, socioeconomic background, different diversity, and that needs to be kept in mind, very important. School counselors should focus on specific obstacles that may adversely affect students, okay? And we mentioned some of the triggers earlier. Divorce, unfortunately, or parents separating, unfortunately very common, but this will definitely cause issues in our youth in terms of how it's handled. Bullying, very big problem. In schools, it used to be just, physical, verbal bullying. Now you've got cyberbullying, which is a huge problem with social media. And again, in most of our webinars, I like to mention that or suggest that if you're a parent and you have a child or a student who is using a smartphone, you really want to monitor it, what they're looking at, what they're doing. I know that's easy to say and tough to do, because they all want to have their smartphones with them. But a lot of schools nowadays, when the child comes to school, the teacher will instruct them to put their cell phones, they'll give them to the teacher for the length of the class. Some don't. There was just a piece on 60 Minutes the other day about a school in New Orleans, St. Mary's, where they don't even allow cell phones to be brought to the school. And that prevents them from being distracted, and it can cut down on the cyberbullying. Conflict resolution, emotional regulation, grief and loss, bereavement, as I talked about, if there's a loss in the family or someone, events that trigger fears, anxiety, and events could be the pandemic, could be a hurricane, could be something in the community that's going on. So whenever there's a negative event in your community, you want to check in with your child. The school obviously has their rules about what to do in the event of a negative issue. They close the school for the day or whatever it is. But you always want to check in with your child when something happens, of any age, college age, young, high school. Are you okay? I know this negative event happened, but talk to me. And this, again, goes back to prevention. Get our young people to talk about their emotions and their feelings instead of shutting down or isolating, then that will prevent usually any kind of mental health disorder from escalating. And again, interventions can be proactive or reactive. When they're proactive, that means prevention. When it's reactive, it means there's no real prevention, no communication, and then they develop or have a negative mental health episode, psychotic episode, whatever the level of it may be, and then you're in the reactive situation, making the child safe and things like that, which is more difficult. It's going to happen here and there, but you always don't be afraid to ask the school counselor or the appropriate person at the school, do you think my child needs professional assistance? And there's nothing wrong with that. School counselors respond to students in crisis and participate in teams to provide wraparound services, and that just means different types of supports to help the student. School counselors do not diagnose students or provide ongoing therapy for students. Now, this may surprise some people, and here are the reasons. School counselors, if they spent, say, 3 hours counseling a student during school, that would mean that they're spending a disproportionate amount of time on a small percentage of the student population. It puts the student in need at a disadvantage, as they would not be receiving the proper counseling time necessary for long-term therapeutic services if necessary. And they can provide counselors in schools can provide families with an external resource list and contact information for agencies or therapists in the community. They don't make specific referrals. That means that if your child has been to the school counselor over an issue, and a repeated issue, and it's recurring, at some point the school counselor can give the family, the parent, or the legal guardian a list of local providers. They can't say, okay, call this therapist in particular. That's just a compliance issue, probably an insurance issue with the school, but that's okay. And then the parent or legal guardian would then select a therapist, a counselor. If any positives have come out of the pandemic and things like that, is that there are more counselors and therapists, than I've ever seen available. And yes, I know some of you may be thinking you got to wait sometimes, but you can always, again, if you need to go to a support group, or if you keep in touch with your community, different organizations, usually you can get help, especially if it's a critical situation for your child. But there are lots of counselors and therapists in our different communities available to help. Now, in terms of navigating the mental health system, as we get close to wrapping up, again, I keep mentioning the three-legged stool. Mental health awareness is the first item. Prevalence, causal attribution and treatment options, identifying a mental illness, and that's something you want a professional to do. Psychosocial support, the school counselors, mental health specialists, whether it's a speaker or just someone the school's bringing in to help educate students and teachers about mental health. And then responsiveness, referral systems, training opportunities. And then if you're not sure of your school's particular and specific guidelines, you have every right to ask them, what are you doing in terms of educating teachers and students on mental health? Now you can see from the data here, Louisiana Public Schools, which consists of over 700,000 students, but the social worker, meaning the in-school counselor, the student ratio is basically 1,277 for each student. That is drastically out of proportion. That's more than 5 times the recommended ratio of 250 to 1. However, as I mentioned, one of the few positives that came out of the pandemic, the government has appropriated over $4 billion nationwide for elementary and secondary school emergency relief funding to be dispersed, including Louisiana, over the next 3 years to assist schools with mental health services, whether they need to hire more counselors, or hopefully some educational programs will come out. It's a lot of money that can be dispersed, and that's a very good thing. And hopefully the Louisiana public school systems will disperse that money in the appropriate manner. So that's wrapping up the webinar. Here's just a couple of links, which, as Keisha said, can be available to you. Some good resources: Center for Disease Control, SAMHSA, Substance Abuse and Mental Health Services Administration, is a federal agency. They have a great website. You can always check Google East Baton Rouge Parish School System. They have a section on mental health. And then I didn't put it on here, but also Office of Behavioral Health, which is under Louisiana, the state behavioral health system, has a lot of great resources. So that's it. And be happy to take any questions if anyone has any.
If anyone have any questions, you do have full audio control of the mic, and you can unmute yourself at any time.
Good afternoon. I have a question in regards to HIPAA laws with sharing your, mental health information with the schools.
Yes. Yes, go ahead.
Okay, that's my question. Where is the, where does that come into play? Because once you talk to a counselor, then a counselor will start talking to teachers, and then teachers talk to other teachers. And where does HIPAA come in regards to sharing the mental health information with the school?
Yes, I see. That's a good question. In terms of, I can speak, for the workplace, obviously any kind of medical or psychological issues that an employee is going through, employers are not allowed to share that information with any.
I'm talking about the students, not employees. I'm talking about where's the line? Where is the kids' rights at in
Right.
in regards to going to your counselor for mental health assistance and then them talking to the students or the teachers about it and other people about it? What role does HIPAA play in sharing all of that information?
Right. Unfortunately, I don't know the exact HIPAA laws regarding public schools in Louisiana, and I think that would be a question that each school can answer, or even a counselor, whether it's an outside or the internal counselor. And I'm not going to guess too much, but I would assume that that type of information cannot be shared among teachers unless there's some sort of approval or consent by the parent in terms of if it's in the best interest of the student. It's a very good question. I'm sorry I can't answer that specifically what exactly the rule is, but if you contact the school, I'm sure they can advise on that.
Okay, if there's no more questions, thank you, Anthony, so much for the webinar. It was very informative. And thank you, everyone, for attending today's event. Please visit our website and Facebook page to obtain the conference call information and all webinar and in-person training registration links. Also, there's a survey at the end of the webinar. Please take a moment to answer a few questions. It only takes 5 minutes to complete that survey. It's really quick. We really appreciate your feedback. Thank you attending again today's event. It has been an honor to have you present. A certificate of attendance will be granted to all participants. We hope to see you at our next training. Please keep visiting our website, check your emails, our Facebook, Instagram, and Twitter pages for upcoming events and their details. Have a great day.
Thank you, everyone.